clinical psychologist, and in order to become a licensed clinical psychologist, I had to get a bachelor's in psychology. So I did that at UCSD, and then afterwards I went to do my graduate studies at Argosy, where I got my doctorate in psychology. And during that time period in my graduate studies, I had to do a lot of field work, and so I was doing a lot of assessment and treatment at various clinical sites, learning how to deal with different forms of clinical conditions. After my graduate studies, I had to do more hours of field work, an internship, and pass 2 licensing exams. But as a result of my graduate studies, I was exposed to the various forms of anxiety disorders, such as OCD, and that was very fascinating in terms of the nature, the progression, as well as the treatment modality for anxiety disorders. So that really piqued my interest, and that's why I chose this area as one of my areas of specialization.
Or is it just like something you can just spot right away?
Yeah, there is a difference.
Okay.
So with OCD, let's first define that according to the clinical manual. Okay, with OCD, you must have either an obsession, which refers to the recurrent intrusive thoughts that are unwanted and causes anxiety or distress. So there must be either that or a compulsion, referring to the repetitive behaviors that one engages in to avoid or reduce anxiety. So you must have either an obsession or a compulsion or both in OCD.
Alright. Alright.
Now, in order to qualify as OCD, you must also, these things must cause a lot of time. In other words, you must be spending a lot of time every day engaging in the obsession or the compulsion, at least 1 hour a day, or it has to cause impairment in one or more areas of functioning, such as your academics, your schoolwork, your job. Okay, so that's what constitutes OCD. But as in a habit, a lot of times a habit can actually be very adaptive, very healthy for you. It's not so time consuming. There's a lot of logic or rationale behind having a certain habit, versus in OCD, there really isn't much. OCD versus OCPD, the personality disorder, right? So with OCPD, you're talking about a pervasive pattern where an individual is preoccupied with doing things a certain way, being very orderly, being very perfectionistic, being in control. And most of the time, there's a rationale or a logic behind these behaviors. So a person who has OCPD, they may actually be very adaptive when they're engaging in these different behaviors, when they're being orderly, when they're trying to be in control of the situation. And so in OCD, you really don't have much of that rationale that's solid or based upon reality. And it's not so excessive. Okay. In other words, in OCD, it's much more excessive. In OCPD, it's not so much excessive. And at the same time, there's a lot of adaptive qualities to what a person does when engaging in these different behaviors. Okay. Something else with OCPD, the person doesn't experience a lot of distress or a lot of anxiety or impairment in one or more of the areas of different functioning. Whereas in OCD, there's usually some kind of distress or impairment that's experienced.
Meet certain standards, or just kind of like anybody, really?
Yeah, at this point, it's pretty broad in terms of what kind of individuals experiences or has OCPD. I would say this, though, that it's more common among females. Okay. More of my patients with OCPD are generally female. A person who's very orderly, very organized, a person who likes to be in control of their own life and the life of others, a person who likes to be in control of social situations, a person who's very clean, a person who's very perfectionistic in whatever they do. These are qualities that makes up an OCPD. Okay.
Is it just like more genetic, or is it somebody just like kind of develops it as they go through a certain time period, or how is that?
At this point, there seems to be, well, the consensus in the scientific community is that it's a combination of both genetic factors as well as life experiences. And so that's kind of where we're at right now within the scientific community. At the same time, there is definitely a genetic link And so let's say that you had a parent with OCD and you also had a sibling or a twin with OCD. Your chance of having OCD is much, much higher.
Younger or when they're older, it just kind of like varies in a way.
Yeah. So usually we can see the early signs of OCD developing at a very young age, during
Alright.
teenage years actually.
Okay.
So when you see a young person being stuck with certain rituals,
Okay.
certain practices, certain mental acts, and they are unable to move beyond that, and they get fixated on those things to the point where they feel distress, or they're breaking down, where they're highly anxious. These are the early signs that it may progress into OCD as an
I see what you mean. And then, why are there some cases in which people have OCD but feel as though if they don't complete the task, that something bad will happen there around them? Because I know about one case in which a woman, she would eat like a variety of objects just like randomly, like a marker or anything.
Sure.
And then she thought that if she didn't eat it, then all of a sudden something bad to her family or something horrible would go wrong.
Sure.
Why is that?
That's an interesting case. Yeah, there are some instances where a person believes that they have to do certain things to avoid certain events from happening, right? Such as, in this case, a family member from dying. And so, in our example here, it's very possible that this individual learned that through what's called accidental learning.
Alright.
And so what that means is, it's very possible that in the past, one evening, as she was having a meal, that she forgot to, let's say, eat her broccoli.
Alright.
And the very next day, her aunt died. Okay? Now, as we can see, there's no connection. There's no rational connection between the two events. But in her mind, there is a connection. Okay? And so, based upon that pairing of her not eating the broccoli and her aunt dying, from that instant on, she's learned to be a little more anxious when it comes to eating things, just to make sure that bad things don't happen. And so that's an example of what's called accidental learning. And that happens a lot with individuals who have these obsessions and they feel like they have to follow through and do a behavior in response to them.
Compulsive spectrum, because I've heard about that, but I'm not exactly sure what exactly that is.
Okay. That refers to a family of disorders that are similar to OCD.
Alright.
Okay. And so they're primarily anxiety disorders. So for example, you have something called the purely obsessional OCD, where the person is struggling with mainly obsessions or intrusive thoughts, and not so much the compulsions.
Okay.
Another example of what falls in this family is something called perinatal or postpartum OCD, where a mother, when pregnant, becomes a little more obsessive when she's pregnant and during the months after the pregnancy.
Okay.
Something that you might hear about sometimes is trichotillomania.
Okay, yeah.
Yeah, when you pull your hair.
Yeah.
It's a compulsion. It's in response to anxiety. At the same time, it can help alleviate anxiety.
Determined as an OCD.
Sure. At this point, there are a lot of different disorders that are kind of similar to OCD. Again, such as the trichotillomania, which is a compulsion, and the compulsion is one big part of what it means to have OCD, right? Or the perinatal postpartum OCD. Okay, so in terms of exact numbers of how many types of OCD disorders are, we don't really know. But there are a lot of anxiety disorders that are similar and falls into the family of OCD.
How severe can the symptoms of an OCD be?
Sure. So according to the Yale-Brown scale, the symptoms can range from subclinical, in other words, they're not really impairing or causing distress, all the way to extremely, where it does cause impairment and distress, in which case the person would meet the full criteria for OCD and treatment would be recommended.
Where you just kind of have to watch it like in everything you do.
Sure. So there is a way to treat OCD, okay, but it starts with the person actually acknowledging and recognizing that there is a problem, that they are experiencing intense distress and impairment as a result of having the obsession or the compulsion. So it starts with that acknowledgement, that realization within the individual, and then they seek treatment. Now, as far as what works in treatment for OCD, right now it's widely accepted that cognitive behavioral therapy is the most effective. And cognitive behavioral therapy is just basically a fancy way of saying changing your thought and changing your behavior, which in turn will give you a better life. One of the techniques within cognitive behavioral therapy is something called exposure and response prevention. And that's very effective in dealing with the symptoms of OCD. So let's say that you have this thought, this obsession, that there are 1,000 germs on this plate, and because of that, you have to wash it 100 times before actually having a meal on this plate, and you won't otherwise.
All right.
That is your obsession, okay?
Okay.
So for me, in using exposure and response prevention, what I would do is I would get that plate and have you sit in front of that plate and allow you to feel the distress, the anxiety, in thinking what you've been thinking about the plate. So I will allow you to feel the anxiety as you're looking at this plate, as you're in the presence of this plate, which you think has 1,000 germs that will possibly make you sick and kill you. Okay? And I will not let you wash this plate. And I will go further and have you have a meal on this plate without washing it. And so I am preventing you from responding in the way that you normally would. So there's exposure and there is response prevention in that situation. And if I do that enough, that anxiety that you had originally will slowly go away, your obsession will change, your thought will change, and your behavior. There will be changes within the way you see the situation. And once those changes are permanent within yourself, it'll be easier for you to approach it. And naturally, your behavior will change based upon the change in your thinking. In general, cognitive behavioral therapy is the way to go in the treatment of OCD. In more extreme cases, medication may help. If a person is feeling extreme anxiety to the point where they really can't participate in treatment, they can't participate in the exposure and response prevention, they may need some medication to kind of calm themselves.